All right, we're diving into some interesting stuff today. A bit of a controversial topic, actually, in the world of weight loss and mental health. We're going to be talking about GLP-1 receptor agonists. You know, those drugs like Ozempic and Wegovy that everyone's been raving about for obesity. But there's this recent study that's suggesting there might be a catch, a potential link between these medications and an increased risk of psychiatric issues. Kind of concerning.
Yeah, it's definitely got people talking. I mean, GLP-1 RAs have been amazing, right? They're really helping people lose weight, and that's great for managing all sorts of health conditions that come with obesity. But this new research, well, it's raising some eyebrows for sure. It makes you wonder about the whole mental well-being aspect of it.
So we've got this like global obesity epidemic happening, and these drugs kind of seem like the answer, like a miracle solution, you know?
Mm.
But now we have to consider this possible downside, these mental health risks.
Mm.
What's the bottom line here?
Well, let's start with the basics. I mean, everyone knows that obesity is a huge problem. It's linked to heart disease, type 2 diabetes, even some cancers. So we need solutions, right? For a long time, the main option was bariatric surgery, which can be effective, sure,
Right.
but it's expensive and it comes with its own set of risks.
Right, it's a pretty big deal.
Exactly.
And then these GLP-1 RAs came along, and they seem like a much easier fix. They work by like tricking your brain into thinking you're full, so you eat less and lose weight. And the results have been pretty impressive for a lot of people, haven't they?
Absolutely. I mean, the initial studies, they were super promising. But this new study, it's throwing a bit of a wrench into things. It was published in a really respected scientific journal, so people are paying attention. And they analyzed data from over 162,000 people with obesity. They compared the folks using GLP-1 RAs to those who weren't.
And what did they find? What's the big reveal?
Well, it's a bit of a bummer. They found that the people taking these medications had almost double the risk of developing certain psychiatric disorders.
No kidding.
Yeah, like major depressive disorder, anxiety, even in some cases, suicidal behavior.
Wow. Okay, so not just like a little increase. This is like a significant jump in risk.
Exactly. The numbers are kind of shocking when you see them. The risk of major depression was 195% higher. For anxiety, it was 108% higher. And for suicidal behaviors, it was 106% increase.
Okay, yeah, those are some big numbers. That's pretty alarming, to be honest.
Yeah, it's definitely something to take seriously.
And did they say anything about whether, if you take these medications for a longer time, does the risk keep going up?
You know, they did actually. And that's one of the things that makes this even more worrying. It seems like the longer you're on these medications, the higher your risk for these mental health issues might become.
So it's like this ongoing, growing risk. Not everyone taking these medications will have these problems, of course, but it's important to know that the risk is there.
For sure. It really underlines the importance of having honest conversations between doctors and patients. Like, before someone starts taking GLP-1 RAs, they should know about these potential psychiatric risks. They need all the information to make an informed decision.
I think that's key, right? It's not about scaring people off these medications. It's about giving them all the facts so they can make the best choice for themselves. Now, I'm curious about the different types of GLP-1 RAs, like Ozempic and Wegovy. They're both in that category, right? Are there any differences in terms of risk between those?
That's a great question. And yeah, they are both GLP-1 RAs. The study actually hinted that there might be some variations in risk. Wegovy, for instance, which is basically just a higher dose of semaglutide, it seemed to have a higher risk of major depression and anxiety compared to some of the others.
So the specific type of GLP-1 RA you take could influence how much risk you're facing. And were there any groups of people who seem to be more vulnerable to these mental health side effects?
It seems so, yeah. The study indicated that women, younger people, and certain racial groups might be more likely to experience these issues while on these medications.
So a bunch of different factors to consider: age, gender, race. It all adds to the complexity of this issue.
Absolutely. And that's why personalized medicine is so important. Everyone's different, and we need to remember that.
Right. What works for one person might not work for another. And what's safe for one person might not be safe for someone else.
Exactly. And this research, it just reminds us that no drug is completely risk-free.
There's always that balance, right? Weighing the potential benefits against the potential risks.
Always a trade-off.
Okay, so we've got this link between GLP-1 RAs and a higher risk of psychiatric problems. But the big question is why? Why would a drug designed to help people lose weight potentially mess with their mental health? Any theories out there?
Well, researchers are digging into that right now. The main theory they're looking at involves dopamine.
Dopamine, the feel-good chemical.
That's the one. It plays a huge role in our mood, motivation, pleasure, all that good stuff.
So how could these GLP-1 RAs be affecting dopamine?
The thinking is that they might disrupt the balance of dopamine in the brain. Like, they might boost dopamine production in some areas, but at the same time, they might also increase how fast it gets cleared out.
Is that like you're making more dopamine, but it's not sticking around long enough to do its job?
Exactly. And that kind of disruption, it could lead to anhedonia.
Anhedonia.
It's that feeling of losing interest in things you used to enjoy.
Like nothing seems fun anymore.
Right, which is a major symptom of depression.
So it all ties together in a
So
way.
yeah, it's pretty fascinating. But it's also a little unnerving, right? Like, you take a medication to target one thing, your appetite,
Yeah.
and it ends up having these ripple effects on other systems like your brain and your mood.
It's a reminder of how complex the human body is. Everything's connected.
Totally.
And we need to approach these powerful medications with caution. We need to understand the full picture.
For sure.
Now, before we get into what all this means for people in the real world, let's talk about the study itself for a minute. Are there any limitations that we should keep in mind? Things that might affect how we interpret the findings?
Of course, no study is perfect. This one, in particular, wasn't a randomized controlled trial, which is considered like the gold standard in medical research.
So it wasn't the ideal type of study.
Well, it wasn't as strong as an RCT. They looked back at existing data, which can be tricky.
So they didn't randomly assign people to take the drug or a placebo, which means there could be some bias in the results.
That's right. And they relied on medical codes to identify psychiatric conditions, which isn't always 100% accurate.
I see.
So while these findings are definitely worrying, we do need more research to confirm the link between GLP-1 RAs and these mental health risks.
More studies to back this up.
Exactly.
So we're seeing some pretty interesting data. But it's not the final word.
Not yet.
More to come on this topic for sure.
Absolutely. Welcome back. So before the break, we were talking about this possible link between GLP-1 receptor agonists and a higher risk of psychiatric issues. Remember, this study wasn't a randomized controlled trial. It was a retrospective study, which means they looked back at data that was already there.
Right. You mentioned they used existing data. So, how does that even work? Where did they get all this information from? And how did they compare the people taking GLP-1 RAs to those who weren't?
Okay, so they use this massive database called TriNetX. It's basically a treasure trove of medical records from a ton of healthcare organizations across the U.S., like over 66 of them. You're talking about a mountain of information on patients' medical histories, diagnoses, treatments, the whole shebang.
Wow. That's incredible. But how do they pick out the info that was relevant to their study? I mean, there must be so much data in there.
Right. So they zoomed in specifically on adults who had been diagnosed with obesity, BMI of 30 or higher. And then, get this, they use this fancy statistical method called propensity score matching. It's a way to create two groups that are as similar as possible, like in terms of age, sex, race, other health conditions, you name it.
So even though people weren't randomly assigned to take the drug or a placebo, this matching technique helps to make the comparison more fair, right?
Exactly. It's like you're trying to create two evenly matched teams for a game
I get it.
so that any differences in the outcome, in this case, psychiatric problems, are more likely due to the treatment and not just because the groups were different to begin with.
Makes sense. Okay, so they have these two groups, the GLP-1 RA users and the non-users. But how did they actually measure the risk of psychiatric problems? Did they just ask people if they were feeling anxious or depressed?
Actually, no. They went for a more objective approach. They looked for specific medical codes in the records. These codes are what doctors use to diagnose different psychiatric conditions.
Oh, interesting.
Yeah, so things like major depressive disorder, anxiety disorders, suicidal thoughts or actions, even self-harm. They then compared how often these diagnoses popped up in each group's medical records.
So instead of relying on people's self-reported symptoms, they were looking for official diagnoses from doctors. That seems more reliable.
Right, exactly. They wanted to get a more objective picture. And what they found was, well, pretty significant. The GLP-1 RA users had a much higher rate of these diagnoses compared to the non-user group.
Right, those numbers we talked about earlier. Almost double the risk.
Yep, those are the ones.
But you did mention this study has some limitations.
Yeah.
Besides the whole retrospective design thing, what else should we be aware of?
Okay, well, first off, medical codes, while more objective than self-reporting, they're not perfect. There's always a chance for errors, human error.
Sure.
And sometimes mental health issues, they don't even get documented in a patient's medical record.
I guess that makes sense. Not everyone feels comfortable talking about those things.
Right, exactly. So there's the possibility of underreporting. meaning the real number of psychiatric issues could be even higher than what the study found.
Hmm, that's a good point.
And another thing is, they didn't have information about lifestyle factors,
Like,
like diet, exercise, stress levels, social support.
right, all those things that can affect both obesity and mental health.
Exactly.
So it's hard to completely isolate the effect of the medication.
Yeah, it's never just one thing.
Okay, so this study gives us some valuable information, but it's not the be-all and end-all. We need to keep those limitations in mind.
Absolutely.
More research is definitely needed to get a clearer picture of what's really going on.
Totally agree. Now, I know we're supposed to be all skeptical and analytical here, but let's just play pretend for a minute. Let's say future research does confirm this link between GLP-1 RAs and mental health risks. Where do we go from there? What would be the ideal scenario for managing these risks?
Ooh, I like that little thought experiment.
Right.
Okay, so in a perfect world, I guess we'd have a much better understanding of how these medications affect the brain, like down to the nitty-gritty details. And we'd know who's most likely to have problems.
Right.
Maybe we'd even have tests that could predict your individual risk,
That would be amazing.
like a genetic test or something.
Yeah, personalized medicine at its finest.
And wouldn't it be great if we could adjust the treatment based on that information?
Exactly.
Like maybe change the dosage, combine the medication with therapy, or even develop new drugs that target those specific brain pathways that are getting messed up.
Now you're talking.
That's like a whole new world of possibilities.
It is.
We could offer these super effective weight loss treatments, but without the mental health risks.
It's a nice dream.
It is. But for now, it's still just a dream.
Yeah, it'll take a lot more research and innovation to get there.
Okay, back to reality. We were talking about those alternative viewpoints earlier. Some experts are not convinced by this whole thing, right? They think there might be other reasons for the increase in psychiatric diagnoses.
Oh, yeah, there are definitely some skeptics out there.
What are they saying?
Well, some of them think that the stress of living with obesity could be a bigger factor, or the stigma that comes with it. They argue that maybe it's not the medication itself that's causing the problems. Maybe it's just that people with obesity are more likely to experience depression and anxiety anyway.
Yeah, that makes you think. Is it cause and effect, or is it something else entirely?
It's a tough question. The chicken or the egg, you know?
Exactly.
And to be fair, the study authors, they acknowledge these alternative explanations. They're not saying GLP-1 RAs are definitely the culprit. They're just saying we need to be careful and do more research.
So it's more about raising awareness than sounding the alarm.
Right. We can't ignore the potential risks, but we also don't want to overreact, especially when these medications are helping so many people.
It's all about finding that balance.
Exactly.
Recognizing the benefits while also acknowledging the concerns.
And ultimately, it comes down to informed decision-making, both for patients and their doctors.
Right, having those open and honest conversations.
Making sure everyone's on the same page
Weighing the pros and cons together.
and choosing the best path forward.
Okay, so we've covered a lot of ground here. But the big question remains, what does all this mean for the future of obesity treatment? Where do we go from here?
Well, that's a great question, and that's exactly what we're going to dive into next.
So we talked a lot about this study, the GLP-1 receptor agonists, and the whole mental health thing. We've gone over the methods they used, the limitations, the need for more research. We even did a little daydreaming about a future where we can personalize these treatments to minimize the risks. But let's get real for a minute. What does all this mean for the millions of people out there who are struggling with obesity right now? What does this study tell us about where we go from here with obesity treatment?
Well, that's the million-dollar question, isn't it? And it's one that everyone's trying to figure out. I mean, the study doesn't erase the good stuff about GLP-1 RAs. They're still really effective for weight loss, and that's important. But it does make us realize that we need to be a bit more careful, a bit more thoughtful about how we use them.
So it's not about throwing them out completely, it's about using them smarter.
Right, exactly. We need to move away from this idea that one treatment fits everyone.
Right, like a one-size-fits-all approach.
Yeah, that's not going to cut it. We need to personalize obesity care, tailor it to each individual.
What do you mean by that?
Well, it means taking a good look at each person's situation, their medical history, any family history of mental health issues, their lifestyle, all of it. We might even need to start looking at genetic markers that could indicate a higher risk for these psychiatric side effects.
So it's like, instead of just prescribing the same medication to everyone, you're taking a more customized approach.
Exactly.
You're considering all the pieces of the puzzle.
Right.
It's like tailoring a suit. You wouldn't just give everyone the same size suit, right? You'd take measurements, you'd consider their body type, their style, you'd make sure it fits them perfectly.
I like that analogy. And that's what we need to do with obesity treatment. Tailor it to each person, taking into account their unique needs and vulnerabilities.
So for someone who's considering using GLP-1 RAs, what advice would you give them?
Well, the most important thing is to have an honest conversation with their doctor. Talk about the potential benefits, but also the potential risks. Don't be afraid to ask questions to bring up any concerns you might have.
Be your own advocate.
Exactly. And if you're already taking these medications, pay attention to how you're feeling. Notice any changes in your mood, your sleep, your energy levels. If something feels off, don't ignore it.
Trust your gut.
Right. And reach out for help if you need it.
So for doctors, what's their role in all of this?
It's about staying up to date on the research, for sure. But it's also about really getting to know their patients, understanding their individual risk factors, and having those tough conversations about the potential downsides of these medications.
It's a partnership, right?
Absolutely. It's about shared decision-making, working together with the patient to figure out the best way forward.
It sounds like the key takeaway here is information. The more we know about these medications, the more we understand the benefits and the risks, the better choices we can make.
Couldn't have said it better myself.
So it's all about being informed, asking questions, and taking an active role in our own health.
That's the power we have as patients.
I love that.
And as we learn more about obesity and how to treat it effectively, I'm optimistic that we'll find even better solutions. Solutions that help people lose weight safely and sustainably without putting their mental health at risk.
That's a great note to end on. Thanks for joining us for this deep dive. And until next time, keep those brains buzzing.